Hello, everyone. Welcome to the session on protecting healthcare beyond its four walls. Thank you for joining us here today. I'm Ming En, a reporter at GovInsider, and I'll be your moderator for this session. We're on the cusp of a dramatic shift in how healthcare is delivered. Delivering remote care is reliant upon IoT, data sharing, and robotics. But this shift creates new security risks. Over the next 60 minutes, healthcare leaders and experts will discuss how to secure remote devices and hospital systems to protect patient information in this new era. We have with us here today Fuller Yu, the Chief Information Security Officer from Hong Kong's Hospital Authority, Chris Ng, Group Chief Data Governance and Protection Officer from the National University Health System from Singapore, Leon Zhang, the Assistant Chief Executive of Integrated Health Information Systems, AIxGov, Singapore, as well as Akansha Villani, the Regional Alliance Head for AWS, APAC, and Japan from Intel. We'll also be hearing from Huang Xiaofei, Principal Security Architect, ASEAN Worldwide Public Sector from AWS. Unfortunately, Xiaofei is unable to join us live today, but he will be sharing his thoughts with us through a video. GovInsider would also like to thank Amazon Web Services for making this session possible. And without further ado, we'll jump right into the session. To start us off today, Leon will be sharing a brief overview on how healthcare institutions can defend themselves in the cyber realm. Leon, please.
Thank you, Bingen. So thank you, everyone, and thank you, GovInsider, for inviting AIxGov to present at this event. I've got about 10 slides, and I've got about 10 minutes, and I'm going to quickly run through very quickly the key salient points that I think we should be concerned about. So very quickly, just maybe some introduction to healthcare. So AIxGov is a entity in Singapore that specializes in health tech. We are the largest health tech company. We have over 3,000 staff, but we are primarily focused on public healthcare. And within the public healthcare arena, we want to improve public healthcare population as well as health administration, through a range of technology services across public healthcare. And just to give you an insight into some of the services that we provide. So we look after about 700 over systems across Singapore healthcare landscape. And you can see here is a range of services that goes from the traditional healthcare services to some of the more newer areas like telehealth, mobile applications. In fact, in Singapore, in many of our hospitals, when they disperse medication through the pharmacies, is done robotically. The prescription is made. There is a robot at the back that packages the prescriptions and is delivered to the patients. So these are some of the innovation activities that AIxGov has managed and developed over the years. So back to today's topic, protecting healthcare beyond its four walls. That was a topic given to me, and when I looked at it, I say, at the end of it is always about the patient. It's always about protecting that patient. And we are protecting that patient in a fairly complex environment. If you look at the public healthcare and all the systems that goes into it, of course, one would say that electronic medical records, if you look at the far right red bubble, electronic medical records are key information that we want to protect, right? But at the same time, there's a whole host of systems and infrastructures that goes behind supporting healthcare. Not just the traditional ICT systems, but it goes towards the medical device, it goes to OT technology, it goes towards technology as well, billing systems, and so forth. So the whole range of it, and each of them have a different classification of risk. So how do we, as healthcare professionals, how do we protect our patients in this diverse, complex environment that we operate in? Let's see if this works. So to answer that question, we need to go back to basics. And there's a couple of basic questions we need to look at. What do we need to protect? I mean, protection is key, but do we really know what do we want to protect? And very quickly, the answer would zero in on critical assets. We really want to protect our critical assets. And the question is, do we know what is our critical assets? And many organizations, it's important to then define what is critical assets so that they can begin the protection journey of doing and making these assets protected. So that's one key question, knowing what assets to protect. Another key question is protection from whom? There are many threats out there. Does your entity want to protect against all forms of threat? Do you want to protect yourselves against a drive-by hacker? Do you want to protect yourselves against criminal syndicates? Or do you want to protect yourselves against state-sponsored actors? So I think that threat analysis, understanding what is at stake and who is interested in your asset is important to answer. And from that, you derive a plan to protect. And that plan will then lead to how do we want to protect? Here I list out risk scenarios, because once we understand the critical assets that we want to protect, and once we understand the threat that we want to protect them from, then how do we go about protecting them? And I suggest we look at risk scenarios. And in one way to look at risk scenarios is look at a cyber kill chain. I think some of you may be familiar with cyber kill chain that looks at reconnaissance all the way to achieving the target. Attackers will typically go through the cyber kill chain, the 7-stage cyber kill chain, and we have to ask ourselves for each stage of those cyber kill chain, what would be the relevant risk scenarios that we want to design to protect against the threat that you have identified and analyzed in order to protect against the critical assets. So these are some of the basic questions I would encourage audience to look out for. Then once you have done that basic analysis and call out, then I would recommend having a layered defense strategy. All right, you put your threat analysis, your risk scenarios, and the assets that you want to protect. Put them against in this case, a 5-layer strategy where you understand from a perimeter defense, from a network defense, application, endpoint data. For each of these layers, what are the different tools and control measures and security measures you want to put in place to protect that particular layer? As you can see, there are more than one controls per layers, and that comes down to your risk appetite. It comes down to your budget to spend, and it comes down to the 3 basic questions that I asked earlier. And by answering those questions, it would therefore hopefully help you dictate and plan the different layers of defense and the number of controls you need to have at each layers. When you go about preparing these layers of defense, it's important to note that defense comes in 2 forms. One is identifying and preventing the situation, all right? Another is detecting the attack. So prevention and detection are key when designing a defense layer. So as much as you want to prevent something from happening, but you may equally want to detect if for whatever reason the attacker gets through your preventive layers, you want to have an equally strong detective layer to be able to detect. So those are some of the sharing I would encourage you to consider. I just drill in on one component of that defense layer. I think if you look at the data, there's one called role-based access. Many systems now in healthcare can be designed with role-based, right? Especially the EMR systems, right? And the ability to build in functionality based on the business roles and access to what data access to what the roles is permitted is important as a control measure. So we would encourage a role-based system access. Better still, if we can control by data access, is even better. Yeah. However, it is not an easy task. In fact, it's quite challenging. For example, identity access management It's difficult because in the hospital settings, we have roving doctors or consulting doctors that goes from one institution to another, and they need to be given access, right? And how do you control the right access to the right consulting doctors for the function that they need? Yeah. So, but role-based system access is one measure that hospitals leaders can consider. Then I want to talk a little bit about the attackers and defenders dilemma. All right. As an attacker, right? Attacker in the public healthcare just need one vulnerability to get into our environment. Okay. As a defender, right? We need to defend everything. We need to defend against everything. But the attacker only needs one vulnerability, and they're in. So that seems to be in favor of the attacker, all right? But yet, as a defender, I call the blue team, the attackers need to evade all the detective mechanism that one has put in the environment. Yeah. Whereas a defender, they need just one alert. If the attacker tripped one alert, then the defender with that one alert is able to put in place a response, or it would trigger a response to defend against the attacker. So these are the dilemma that both attackers and defenders face every day. Yeah. Therefore, what's important? Time will tell. The longer an attacker is in the environment, the higher a chance that they will trip, and therefore your detectors should be able to pick it up and uncover them. Yeah. And therefore, it's important when we design layers of defense that it is complex enough. We don't make it too easy for the attacker to navigate within our environment. The greater the complexity, the greater the layers of controls that we have, it makes the job of the attacker a lot harder. They have to be a lot more creative, all right? And hopefully, they'll just skip your organization and probably go to an easier target, right? But complexity does buy you time, and buying you time does give you the opportunity to detect if they're in your environment. So hence, detection is key. So this statement here says everyone in healthcare has a duty of care. And I want to use the analogy about a community. I think many of us have heard that it takes a community to care for a child. Yeah, and that's quite a common statement. But I would also say that it takes a community to also protect that same child. So if we take that into a healthcare setting, it takes all of us in healthcare to protect healthcare. And the protection comes in many forms, all right? I'll just, in this slide, just to share some with you. For example, fishing, fishing exercise is one common exercise which everyone should get involved. Everyone in healthcare should get involved, and therefore everyone have a role to participate. Another form is simulation exercise. Everyone gets a role. Awareness training, everyone has a role to play. Patching, timely patching and cyber hygiene. These are activities which the IT team has a role to play to make sure that we are patching timely. Yeah. Reporting of suspicious event, is everyone's responsibility, right? If a doctor or nurse look at their laptop and begin to see their mouse is behaving strangely, right? Then there is a duty to report that, so that someone in the security areas can look into it and see if that was indeed just a hack or a simple technology issue. I think another area that we need to pay more attention is around supply chain risks. I think the SolarWinds incident early last year has placed focus on third-party risks and supply chain risks. I think this is an area which is less looked after or looked at in the past, but increasingly getting attention. Yeah. So in a nutshell, these are the kind of 9-10 slides that I have. I just want to end here and hand it over to Ming En. Thank you for having me again. Thanks.
Thank you, Leon, for that insightful sharing. Definitely, I think cyber protection in healthcare is done in a very complex environment, and in response, defense needs to be multi-layered, like you mentioned. And I think further on during the panel discussion, we definitely look forward to delving into some of these points that you've mentioned when it comes to third-party risk, when it comes to having a community on board with the cybersecurity of healthcare institutions. But for now, we'll be hearing from Huang Xiaofei, who'll be sharing about how the healthcare sector can benefit from digitalization in the cloud and how to then secure these systems. So Xiaofei, please.
Good morning, good afternoon, good evening, wherever you are in the world. My name is Huang Xiaofei, and I am a Principal Security Architect here at AWS, Amazon Web Services. I'll spend the next 10 minutes to share how AWS protects healthcare beyond its four walls. If you're a CIO or CISO in the healthcare domain, there's a good chance your organization is considering or has considered an investment in digital health platforms, or DHPs, to better manage costs, understand patient populations, gain critical insights from data, and increasingly personalize the healthcare experience. According to Gartner, by 2024, healthcare providers that have adopted a DHP approach will outpace competition and partners by 80% in the speed of digital transformation and new feature implementation. But making an investment in a DHP solution requires significant considerations. Security is, of course, one of these considerations. Digital healthcare revolves around new tools to collect information. Health information is everywhere. There's traditional information like the one in our health records, but there's also a whole new range of very small biocompatible electronics that we're going to be able to start using to collect data. While digital transformation continues to accelerate ahead, healthcare CIOs and CISOs, like some of you, face urgency to safeguard the security and privacy of healthcare data, often in the scale of petabytes. Yes, you heard right, petabytes. At AWS, security and privacy remains job zero. Specifically, for the healthcare industry, we provide a number of global certifications and accreditations. For example, HIPAA, HITRUST, GDPR, and others, that allow customers to store, process, or transmit their most sensitive data in the cloud and improve their security and compliance posture. Most importantly, our shared responsibility model ensures ownership and control of data remains with the customer at all times. For the uninitiated, the Health Insurance Portability and Accountability Act, or HIPAA for short, is a US federal law that regulates the storage, processing, and transmission of healthcare data, like protected health information. AWS has over 100 HIPAA-eligible services, with continued investments to support healthcare professionals, healthcare workloads in the cloud with our HIPAA eligibility program. While HIPAA is an act that details standards for compliance, the Health Information Trust Alliance, or HITRUST, is an organization that helps companies achieve compliance to those standards. To that end, HITRUST and its Common Security Framework is a widely adopted framework that leverages nationally and internationally accepted standards and regulations such as GDPR, ISO, NIST, PCI, and HIPAA to create a comprehensive set of baseline security and privacy controls. For customers seeking HITRUST CSF certification, AWS customers can design and implement an AWS environment and use AWS services to help them meet the requirements of the HITRUST CSF. We've also launched over 60 HITRUST certified services for customers to use to develop their solutions. And not forgetting GDPR, which has strong healthcare implications too. We also are committed to offering services and resources to our customers to help them comply with GDPR requirements that may apply to their activities. And we continue to see customers leveraging the AWS GDPR Center for Guidance and best practices. As we look across the journey to digitally enhance healthcare, we can group the transformation into three categories: IT cloud transformation, predicting healthcare relevant events, and personalizing the healthcare experiences. With the limited time I have in this session, I will dive deeper into IT cloud transformation and provide a better understanding of how AWS can help in this phase of transition. First, let's look at some key industry trends and benefits of utilizing cloud-based technology in healthcare. The adoption of cloud technology has been increasing at a frenetic pace. There are quite a few drivers for this change, but much of it comes down to a simple analysis of costs and benefits of cloud infrastructure. For behavioral healthcare organizations, cloud computing solutions can frequently provide better levels of service as compared to their internal IT efforts. Part of this has to do with scale, but much of it is the investment in personnel, technology, rigorous processes, and expertise that cloud providers can bring to healthcare IT. Let me now share some of the most common advantages of cloud computing in healthcare organizations. These different levers can help guide decisions about what type of technologies should be supported in-house and what are those to move to the cloud. Scalability and flexibility of data storage. One of the biggest current applications of the cloud in healthcare is data storage. The healthcare industry works with a tremendous amount of data, and even the most sophisticated hardware installations can't handle it all. Cloud-based services, on the other hand, allow companies to address fluctuating demands. When a need arises, it is easy to scale up or scale down the organization capacity with what amounts to a push button. When every second loss affects patient safety and budget, flexibility can be a real competitive advantage. Cost. Today, healthcare companies spend upwards of 75% of their IT budgets on maintaining internal systems. Cloud networks allow healthcare professionals to store all the data they use offsite to avoid the cost and strain of maintaining physical servers. Cost savings of cloud versus on-premises or on-prem data centers are roughly 50 to 90%, allowing healthcare organizations to focus on operational and clinical efficiencies that will improve patient outcomes, increase consumer engagement, and lower costs to the healthcare system. Security and reliability. Two of the cloud's strongest features are the security and reliability that it affords an organization. For example, if a healthcare provider is using a computer that happens to have protected health information on it, the loss of the equipment could potentially be a breach that could cost the company millions of dollars in penalties. If that same organization was utilizing the cloud, the computer could be remotely wiped if lost. The cloud also can increase the reliability of data redundancy and system uptime. It does this through the automation of backups and disaster recovery options. In simple terms, this means that an organization will not lose data and will have the ability to minimize any downtime for their staff. Collaboration and innovation. Collaboration is vital to the healthcare industry. The cloud provides the infrastructure to store and access data remotely so that healthcare professionals, systems, and applications around the world have access to patient data immediately and are able to expedite necessary patient care. Before I end my talk, let me share a unique customer story with you. Philips is a Dutch-based company that focuses on the areas of healthcare and consumer lifestyle solutions and services. Philips wants to reinvent healthcare for billions of people around the world and has built its Health Suite data platform on Amazon Web Services. Health Suite analyzes and stores 40 petabytes of patient data gathered from millions of imaging studies, medical records, and patient inputs to give healthcare providers actionable data, which they can use to directly impact patient care. Running on AWS provides the reliability, performance, and scalability that Philips needs to help protect patient data as its global digital platform grows rapidly. What about security? By utilizing AWS, the Philips Health Suite data platform, or HSDP, safeguards health and other sensitive data in the cloud through a certified information security management system. Specific security services within HSDP include external audits and penetration testing, privacy security and regulatory controls, and operational security. HSDP also maintains an extensive set of external compliance certifications and attestations to provide objective evidence of compliance to security and privacy regulations such as ISO 27001, SOC 2, and HITRUST. With that, I come to the end of my brief talk. I hope it has been informative and useful to you. Thank you and enjoy the rest of the session.
Thank you, Xiaofei. I hope all of you enjoyed his sharing about how AWS can help with digitalization in the healthcare sector and how to secure these systems. Now I would like to invite all our panelists to join us as we head into the discussion segment of this session. Welcome to all our panelists here today. So far, we have heard from Leon and Xiaofei about some of the broad concerns surrounding cybersecurity in the healthcare sector, and we'll definitely be delving deeper into that in just a bit. But before that, I want to set the stage a little for how healthcare is transforming or has transformed, especially in the 2 years since the pandemic. So since the pandemic started, we've seen a rapid adoption of remote care and telehealth. So I just want to understand a little bit about how that looks like in your respective organizations. So to start us off, maybe Fuller, you could share a little bit about that.
Thank you. Good afternoon, everyone. I think I do enjoy the presentation from the previous speaking, especially Leon. He talked about a lot of very practical, challenge and also practical tips around to managing those cyber risks for your organization. As the question is around the remote and telehealth, I think it's really is very, very common in the previous 24 months, particularly during the pandemic. We see there's a huge demand coming in. I think this is really the first time we see is really the business-driven initiative to really adopt to these technologies, because this is a very solid demand, and that's a really, and also the isolations a challenge. So that this is a perfect time for us to really deliver the telehealth services to the patients and through the technologies. I think we see this quite common, not only in Hong Kong, Asia Pacific, we see the same case for both developing and also developed country. And of course, there's quite a lot of challenging, but I do see this as a very great opportunities for those healthcare sectors to really adopt to these technologies. And this really forming a very driving force to accelerate the digital transformations for the healthcare industries. That is may not be happens if there's no pandemics.
Thank you, Fuller. Over to you, Chris. Do you have anything to add about how telehealth is transforming the healthcare sector here in Singapore?
Hi, afternoon, everyone. So I'm Chris from the National University Health System. So we are one of the 3 public health clusters in Singapore. So I have to say that telehealth was actually very nascent in Singapore pre-pandemic, and NUHS was dragged kicking and screaming into telehealth when the pandemic started. So early in 2020, when Singapore imposed this circuit breaker, aka lockdown, one of the first things that the Ministry of Health required was that all non-essential consultations had to stop immediately. You can't come in person anymore. So because of that was the alpha variant at that time, right? So immediately many doctors had, and clinics had to transition to telehealth. And it was actually the beginning of a long journey. So in fact, if you think about telehealth, there are many aspects of telehealth. You have everything from telephone consultations, which is telehealth in a way, all the way to remote surgery, which is another form of telehealth, right? And we really were in the nascent stage. So I think when we first started out, it was really a lot of telephone and video consultations. And I think over time, we have sort of advanced. But in doing so, I think we learned a lot about telehealth. And it's not just about, a lot of people think telehealth is really like, okay, you can see a doctor through Zoom or video. And yes, NUHS does use Zoom to conduct video consultations, but it's the end-to-end value chain that creates a huge amount of issues. Everything from appointment scheduling, getting in touch with the patients, verifying their identities, going through the consultation, doing the follow-up, distributing the medications through courier services, and so on and so forth. Those kinds of remote care is an end-to-end chain, and so far it's been quite challenging, even for many healthcare institutions, to actually link up the value chain, because as you know, there's not one common platform that does all of that. Everything from, so if we use Zoom, Zoom definitely doesn't have any of these functions to schedule appointments according to our clinicians' calendars. So it's been challenging. It's still a work in progress. And the security challenges at the start were not very well understood. But I think as we have the opportunity to talk about it more, I think we can share some of our learning from that area. So really, we're currently in a stage of a lot of telephone consults, a lot of video consults. We don't do fresh consultations through telehealth. We mainly do a repeat visits. So when after, for example, the patient has seen the doctor for the first time and he just needs follow-up for chronic care, high blood pressure, heart congestion, for example, then we use these kinds of telehealth situations. But beyond that, for the more complex cases, they're still in-person visits. Yep.
Okay, thanks for that, Chris. I think it provides a good overview of kind of how telehealth has evolved in Singapore in the past 2 years and what stage we're at the moment. So moving on to Akansha, I guess, coming in from the perspective of a cloud or tech provider, how then does all these help support healthcare institutions in bringing telehealth and remote care to patients, taking into account kind of all the challenges that Chris has mentioned earlier?
Yeah, I think it's been a huge learning curve for not only obviously people in healthcare and the government or the institutions or even the public health organizations, but it's been a learning even for technology providers like Intel as well as AWS, because the more and more, the development of challenges because of the pandemic, because of in general, health not being very safe for the citizens and the government not really being able to contribute to wellness of citizens obviously brings a huge factor of worry for the countries, especially in Singapore, especially when Ministry of Health, et cetera, are so dedicated to making sure that all citizens are safe and secure and healthy. So when we deal with such situations and challenges, us as technology providers want to ensure that we are customizing the need for technology to help actually mitigate the challenges that the government or the country is facing. And so through that, what we've recognized is that the need for access, the need for security, the need for data protection, the need for being able to have a hybrid infrastructure and architecture to be able to drive access to doctors as well as patients for the government as well as citizens is very key. And I don't think there's a one size fits all. Every business challenge as well as health challenge is different. So if it comes to hospitals, it's about how can technology from cloud to the edge leverage AI and IoT to ensure that doctors are continuing to be able to even treat patients, not just for medication, but also for surgical reasons. How can we make sure that you have a platform that the country can support to help drive better vaccinations, for example, for the citizens so that they are more safe and secure against COVID or other diseases. So just exactly to coin on that effort, it's the fact that, the Trace Together app that all of us use is actually built on cloud technology that is powered by Intel and AWS. You've got a whole lot of e-telehealth institutions as well as portals that our ISVs today are building on that are able to provide access to doctors and patients collectively. So it's really about trying to ensure that you have the customized heterogeneous access to technology to help solve the challenge that we need to solve for healthcare. And like I mentioned, it's not one size fits all. Cloud would work and infrastructure would work for someone. The use of AI, IoT, HPC to help drive better data crunching and insight is also Did I say something wrong? Yeah, same. I thought it was me too.
Okay, I think the technical issues have been resolved. Akansha, maybe you could repeat the last sentence.
So I think everyone got what I was trying to say. To summarize, it's really about customizing technology for making it sure that making sure that it works for healthcare as a very large segment for the country as well as for the nation and internationally.
Definitely, thank you for the insights. I think, it's nice to hear from kind of a different perspective as well of how technology providers are thinking about what they can do to help healthcare institutions during such troubling times as the pandemic. As all healthcare institutions are like Chris mentioned, just being dragged over the line of telehealth and trying to adapt to the new changes amidst dealing with a pandemic. So I think going back to the main topic of this panel, which is really about protecting healthcare and security, right? So my next question is actually for Leon. What are some of the security challenges that arise when healthcare organizations are switching over to remote care, to telehealth, and what is AIxGov doing, or what can healthcare organizations do to address some of these challenges?
Yeah, thanks. That's a great question. As we move towards telehealth and remote health, security remotely is increasingly the challenge. And how do we provide that sort of remote consultation in a secured form? And I think increasingly organizations need to consider multi-factor authentications to do that. Many a times, when I still remember the early stage of COVID-19 when Singapore tried to move quickly into telehealth. Then even a discussion like Zoom, is having a telehealth consultation using Zoom, is that secure? When we are discussing patient-sensitive data on Zoom, right? So those are very real issues when it comes to remote tele support. So I think the ability to authenticate whether the person you're speaking to on the other end is legitimate, I think is important. And hence, to my suggestion about having multiple factor authentication is one. Another is, as much as we have a lot of emerging technology, in my mind, people risk remains the highest risk to manage. We may have the best technology and the most innovative technology, but if the person operating that technology or the user do not adhere to the good practices, then that becomes the weakest link in security. So education, awareness, ensuring the healthcare workers and also the patients operate and engage themselves in a secured manner is important. And therefore, leveling them up with the right understanding, awareness, and training is key. So I'm just going to offer those 2 points to you. Thanks.
Yeah, so I wanted to add on to Leon's great answer. And I wanted to say that one of the biggest challenges that we realized going into the telehealth journey was that the topic is protecting healthcare beyond its four walls, right? So within the four walls of a hospital, our own secured systems, right, we can do a fair bit to protect. But once we're reaching out to the patient, the customer at the end of the day, he wants to use platforms that he can use. He wants to use Zoom. Zoom is, when we first started, was like not the most secure platform. So if you go back to 2020, you read all the security issues surrounding Zoom, it was a real concern, I think, for both AIxGov and ourselves, whether we should continue to use Zoom. But here we are still using Zoom because that's what the public wants. Trying to force people onto a platform which they have to download, pay for, sign in, multi-factor authentication, and they'll just say, I'll just go to the clinic. And there'll be no more telehealth. So I think balancing between that usability and open access, as Akansha had mentioned, versus security was something that we wanted to do as well. And one thing that this is not purely cybersecurity, but there was a whole host of concerns around medical legal considerations. Like if you made the wrong decision over telehealth, are you still responsible? If AI decided to prescribe this medication and it didn't turn out well, are we still responsible, and things like that. So those are actually, it's not cybersecurity, but it's as much a factor in all these discussions as it happens. And this has been a really interesting conversation we've had over the past 2 years.
Thanks for your inputs. I think that's definitely a consideration to have, to look just beyond the cyber part, right? And I think my next question actually is for you, Chris. So kind of in your position as a data protection officer, and with things like remote care, telehealth, data becomes a very important tool that all of these technologies run on as well. So what are some of the challenges then in collecting, storing, and managing this data as systems go remote? What new vulnerabilities does it pose to healthcare organizations?
I mean, I can talk about more than just a cybersecurity vulnerability. So in telehealth, one of the biggest challenges, I would say, coming from a data quality perspective, is that you actually have vastly non-integrated systems and humans trying to manage it all together if you're not on a complete end-to-end platform. Right? So you actually run the risk of, as Leon has said, the human error part in not getting the right patient on the line, accidentally disclosing one patient's data to another, or not entering what you found on Zoom into the electronic medical record system and then causing data quality issues down the line. So those are quite a fair number of the things that we have encountered so far that we've tried to resolve through better processes. So that's not so much of a cyber issue. But from an innovation standpoint, I think our clinicians are ready to go further. So they are even considering things like remote monitoring devices, for example, blood pressure devices that connect to the internet and then send that data over direct into our medical record system. So then you have to think about all these kinds of cybersecurity end-to-end issues, right? You're not just thinking about on the patient's end, what is he doing, but you need to consider the device, the platform intermediary that's sending you the data, and a whole host of the value chain of the security issues that come out from that. So I think where we are at in terms of simple teleconsult and phone consult, it's the security issues not that high from the technical standpoint, but once you start integrating with more IoT devices and you're starting to go deeper down the technology curve, then I think that's when we really need to take a really strong look at some of these providers and what are their security stances and which kind of platform providers are they using. And in a sort and when you're going into this innovation research kind of field and you're experimenting this, you're often not dealing with very large established players. You're often dealing with smaller outfits that are startups trying to make their names in these areas. And then that's when it becomes challenging for people like Leon and myself trying to evaluate all these products, try to figure out are they safe from a data sovereignty standpoint, where are you sending the data to, and things like that. So those are the big challenges in the collection and protection of data as we move further along this telehealth journey.
Indeed, I think what you said also kind of ties back to what Leon shared in the beginning in his presentation about how all of this is in a very, protection in a healthcare institution is a very complex environment incorporating a lot of things. On that note, my next question is directed to Fuller. So with all these considerations in mind, with things like IoT, with wearable devices, and I think even earlier on what Leon mentioned about third-party risk, what are some steps that healthcare organizations can take when it comes to avoiding the common security pitfalls when it comes to maybe human error or third-party risk? And what advice would you give to healthcare institutions?
Yes, I think thanks Chris and Leon provide lots of very good insight around the healthcare challenging and also the security risk. I think I just want to talk about some of the pitfalls more around the process. In fact, I think Chris and Leon covered that already. Talk about in those remote and telehealth. I think this is a new area that is not before the COVID, which is the healthcare. We are running on more a closer level or closer system. So you own your system and then you can own your device as well. However, in the remote and telehealth scenario, there's a lot of devices out of organization's control. So there's a pose the new security risk around those devices that are out of control. And the second area is more around the integrations. I'm talking about the particular in the clinical context. We always talk about the closed loop concept. It means that when you start with the patient come in, you have to really, the whole process has to be closed loop. And in the old day, your system may already have this kind of closed loop from the dialysis consultations, and then have those prescriptions, and also the laboratory testing and so on. So that could be already a closed loop in the system. But in the telehealth, this is a lot of open end, and that cannot be closed, cannot be integrated with your system, and this is pose a huge challenge, and this could involve a lot of human intervention. And I think Leon talked about those human error. Also pose a lot of additional administrative controls that we may rely on the user to really take care of some of the data collection and the data processing, and that is tied to the user awareness. So with this kind of integration challenge, this is opposed to the integration challenge on both the technology side and also the process side to remain those closed loop processing. I think this is quite huge challenging, and I think in the previous 24 months, I think everyone tried to adopt these new technologies and adopt this new way of doing those business operations. So in fact, I think we should not look into as a purely IT issue. This has to be work with those clinicians and the frontline to work with them hand in hand to provide a more holistic solutions and make sure we can still to minimize the impact to the operations, the clinician clinical process when we introduce this kind of new way of telehealth. Yeah.
Thank you, Fuller. I think building upon what you said about kind of involving clinicians and all of that, I think earlier Leon mentioned about how protecting healthcare is really something that everyone needs to get involved in, right? So can you maybe share, Leon, about some of the challenges when it comes to getting everyone on board in security protocols in healthcare, and how healthcare institutions can take steps or implement policies to address this challenge?
Yeah, I think in my sharing, I did call out. Let me use phishing as an example. I think I mentioned people risk being the biggest concern. Phishing is one of the most common way that attackers will come through. Majority of the attack pattern comes through phishing, but yet it's phishing through people, right? And people is the biggest vulnerability. So we do a lot of awareness training, we do a lot of e-learning, we do a lot of training and quizzes and all that. But I think training and awareness only get us so far. What we really want to get to is change in behavior. And in AIxGov, we also apply, in addition to awareness training and all that, we also apply consequence management. So we do inform the staff, if they get, so we run phishing campaign and phishing exercises. If they get phished once, they get a letter from their head of department. If they get phished twice, they get a letter from me. If they get phished the third time, then there's going to be some impact to their performance rating and so forth. So I think we need to balance the stick and carrot approach if we really want to change their behavior.
Okay, thank you for sharing. I think that provides a pretty good overview of kind of the common challenges faced by healthcare institutions when it comes to cyber risk in the age of remote care and telehealth. So now I think we want to have like a broader overview of the transformation happening in the healthcare industry, right? So Akansha, could you maybe share a little bit about how beyond telehealth and remote care, what are some of the other forms of digitalization and tech innovation that has been transforming the healthcare sector in recent years?
Yeah, it's really been, Mingyan, about how pervasive and important technology could be for hitting the various use cases and segments of healthcare. I think in addition to telehealth being a strong consumer of technology, I've also seen, just working on multiple projects with the government as well as industry leaders, policy leaders, it's also been in the world of research. So trying to identify ways in which you can use heterogeneous technology like cloud, like AI, like IoT, like edge, like even network transformation is really helping transform not only just drug discovery, but also disease mitigation. So definitely research around that and identifying ways in which you can prevent health hazards, on the current diseases that are out there that are affecting the country or the population or even the world is very, very important. And I think the research, which is based on what Chris mentioned, and I think it's his favorite topic, about access to data that is current, that is scalable, and that can actually give the insight for future policies and developments is very important. So I think that's definitely one other segment in healthcare where I have seen a whole lot of technology innovation and adoption, and even openness from the skilling that has been developed. I think a lot more people are a lot more aware. I've definitely seen a metamorphosis of adoption on that front, which has actually helped. If you look at the work that Pfizer or Moderna or any of the vaccine developers have done, what used to take 5 years to get approval for now can take 2 years, and we're still looking at data points that hopefully are driving benefit to healthcare. And while they've switched what those rules are, just for COVID, but obviously these rules are going to switch in the future on the journey of analyses that is needed for how well a medicine is, or how good a medicine is for patients that are dealing with that problem. So that's definitely one, research and disease and healthcare mitigation. The second is, I briefly touched on the project that I talked about, which is, the vaccination drives. How the use case of being able to administer medicine and medication that might or might not be on a tele platform is also something that the ministries of health across various countries are looking at. How do we get access to healthcare for patients, for citizens, to keep them healthy, to keep them safe? And so again, cloud is an amazing platform to be able to do that. And getting the right type of domain experts, along with the IT analysts and the IT holders of technology within those government houses or institutions is again very important. I also do see, especially in the startup community, a whole lot of healthcare applications that are, evolving day by day to help address various health challenges that citizens or people actually are dealing with, which has come out of, healthcare policies that the government has let out for the companies and the industries to provide the technology to help. So yeah, I do definitely think that, yes, telehealth is important. Administering healthcare is important. Research on healthcare is important. And then being able to drive the right type of mechanisms to carry that healthcare effort into making citizens more safe and healthy is also important. And converging all of that with technology is really the key focus.
So I wanted to add on to what Akansha was saying from our perspective here at AIxGov. I do think that tech in health is advancing in 3 ways. The first way is improving the patient experience. So many industries have transformed themselves, especially the financial sector, into improving the patient experience to almost a purely digital experience. If you've been to a public hospital recently, you know that it's not like that at all. So how do you improve the patient experience, not just remotely, but also at the hospital? I think that's something that's interesting. The second one is, as what Akansha says, is improving using technology more in the quality of care. So these are things like using AI to do more of the image recognition to help clinicians out, improving clinician decision support. When they're encountering edge cases, for example, that's not really within their area of expertise, how then do they get this information out quickly? And there are many interesting applications in this area, including augmented reality, right? How can you use previous learnings and then augment onto for example, surgery at the moment in order to help the surgeon perform his job better? And the last one is something that's very interesting that Singapore is embarking on. And it was just recently announced by the Minister of Health, which is really taking a more preventive approach to healthcare. And that really marshals the whole of the health community, not just the hospitals, but from the primary care onwards, and also help having the citizens take care of their own health outcomes. And that involves a lot of data sharing out of the hospital environment and across the whole country in Singapore's case. So that part is a challenge because you're balancing between the outcome of having multiple hands in a pie to help manage a citizen's health versus the security of the data and who is accountable and responsible for it when bad things happen. So those are three areas where the tech is, I think, in my observation, has been advancing, and it's a lot of interesting challenges that we have to run through over the next couple of years. And I'm glad quite a number of technology partners that we work with and that AIxGov works with also thinks quite deeply about this area as well. It is a big challenge and something to look forward to.
Thank you, Chris, for your inputs, and Akansha for your sharing as well. I think when we talk about all the different innovations and tech coming into healthcare, one thing that I think was mentioned earlier on as well is how to balance between security and open innovation and ensuring that technology is accessible to everyone. So I think my next question is for Leon. Can you share a little bit about some advice you would give to healthcare institutions who are trying to balance between the two? What are some steps they can take to ensure that they maintain a strong security posture even as they try to provide better services for their patients or to help the healthcare workers streamline their work?
Yeah, it's a good question. It's a challenging question for many institutions. When I started on this journey, I realized, when you talk to clinicians, they are great at providing care for their patient. And when you provide care for the patient, it's about managing the risks to the patient from a healthcare point of view, what prescription or what treatment they would advise. But yet, when it comes to security, they are equally the best person to manage risk because, it's similar to managing the risk of patients. So at the end of it, it's also about a balance between risk appetite. And for many organizations, how much to invest in security without disrupting business operation, without disrupting hospital operation. That is the balance that many institutions have to work out. Yeah, and that balance is a function of your appetite of the organization. How much security means to you versus how much the business operation means to you. And once you find that balance, and that's the balance you need. And there's no such thing as if you want a zero risk environment, then you're out of business. You can't provide healthcare, right? So it's about taking some risk while maximizing the care to your patient without and being able to have a response should unexpected things happen. The ability to respond to it in a quick way to contain the situation is probably something I would advise most institutions to take. Is that balancing, is that trade-off between costs, business benefits, and risks that organization needs to consider. Thank you.
Thank you, Leon. I think we have time for just one last question for Fuller. I think we've talked about how healthcare is always transforming, and Leon just mentioned as well the need to balance between the risk and providing better services for patients. But as much as healthcare is transforming, so are cyber threats. So can you share a little bit very quickly about some of the cyber threats that you expect may become more prominent in the future and how healthcare institutions can prepare for them?
So I think healthcare is still a low-hanging fruit compared to other industries that has a higher security investment. And unfortunately or fortunately, healthcare is in fact one of we call CII, critical information infrastructure. I know Singapore, this is well-defined by the Cybersecurity Act. And also there's a similar law or act in other countries. So in fact, healthcare as a CII, which is very important. However, the problem is that the investments on the security side is not equally, matching this level. So I think the threat is really come from a few areas. Still, I think it's highly financial motivated actors that is really look for easy targets through ransomware or double extortions that is really looking for money by locking up your file, so impact your services or delay services, and hopefully can get the request for the ransom. And this is one piece of that. Secondly, we also see this is also espionage on the information, particularly those information related to the healthcare science or those pharmacy companies, organization, because this is really quite a lot of very crucial information that is really interest at high value. And finally, patient data is always more valuable than those financial data because they are not likely replaceable. And this is all those practice that is really emergent. And finally, I would expect, as I think Leon and also Chris mentioned about, there's a lot of new technology coming up. We talk about 5G for those remote surgery. We talk about the more adoption of the IoT from the end user level to the medical level. There's a lot of those new device is coming up to your levels. That's not the case in the previously. So that you really create lots of new threats in terms of the internally. And finally, users still pose a significant risk. And we expect that there will be more users, not only the clinician but also the patient themselves. Because we talk about the primary care, we talk about we encourage the citizen to managing their own healthcare data, their own healthcare status. That means that more data will be shared external outside your organization. That means those user awareness will be also a challenge. You may not only need to educate your own users, your own staff, but you should also to provide the same level of education awareness to the end user. That could be every citizens in your countries. Yeah. So I think this is those risks. I think it will create keep as CISO we still have the job, and I think this is also a lot of opportunity for anyone to want to join in this this industry. I think it's very promising.
Thank you, Fuller. And on that note, I think that's all the time we have for today. So thank you all the panelists for your sharing, for your insights. I hope that everyone here learned a thing or two about how healthcare institutions can safeguard their systems even as they digitalize. And I think to close this session, I also want to bring it back to a message that Leon shared at the beginning of this session, that at its heart, protecting healthcare is about the patients. So to keep that in mind when you are pursuing any innovation or technology that you wish. Once again, a huge thank you to everyone for joining us today. Do stay tuned to the final session of the day and also the final session of AIxGov, which will be on cyber diplomacy for a safer future, happening at 4:45 p.m. The session will discuss what's needed to protect citizens from wide-scale cyber attacks, the steps to take towards a more regulated cyberspace, as well as how countries can work together for a safer cyber world. Once again, thank you all for joining us here today and have a wonderful day ahead.
Thank you.